Digital inclusion is one of the priorities in NHS England's drive to reduce health inequalities. Digital approaches are vital tools in helping health services to achieve their vision of making sure everyone, regardless of their background or income, can benefit from the internet and technology. The goal is to reduce the risk that some groups are excluded, overlooked, or neglected as services are transformed. And so, SCW was commissioned by NHS England's Health Inequalities Improvement Team in October 2022 to support the development of a framework for NHS action on digital inclusion. The national framework aims to draw on expertise and learning from across the health system. It addresses the barriers that have stopped people from going online or using digital technologies and promotes guidance and best practice to improve digital inclusion for all groups. In support of the framework, we carried out a thorough evidence review of previous studies evaluating the effectiveness of interventions. These interventions had been designed to better enable digital participation in healthcare among disadvantaged groups. They also included interventions to mitigate against digital approaches contributing to health inequalities. The insight was supported by a desktop review of digital inclusion evaluation toolkits. A raft of case studies were also collated, highlighting best practice examples from organisations that are leading the way in digital inclusion. The case was further strengthened with an evaluation of economic information supporting digital inclusion. We provided hands-on support for the communication and copywriting of the framework document. We hope to continue to support the digital inclusion agenda going forward and make a positive difference to service users across England.
The team at SCW were really professional. The work on digital inclusion was really complex, and they were able to take my general requests and to change them into tangible solutions. We did some really good work on case studies together. I was really impressed by the approach that the team used to put forward really insightful things that we know are going to be really valuable for the whole system. I'd really recommend working with them.